this actually, this is a good question. So the question is, can a liquid biopsy be performed if there is no solid tumor present or detected? So I think it was Dr. Thompson. You showed some data on number of sites, and I apologize, Dr. Dagogo-Jack, if that was your slide. But the presence of extrathoracic metastases improves the probability that you're going to find something if it's present. And the greater the number of sites, and in my experience, the greater the bulk, the more likely you're going to find something by liquid if it's present. And so if you're in a situation where there's so little cancer that you can't see it, I think your sensitivity of liquid is not going to be what you're looking for. And I invite my co-panelists to comment further on this, but there was a very strongly related question about whether liquid biopsy could be used for screening for never smokers, because we don't really have screening. We don't have screening for never smokers right now, whether this technology could eventually be used to help detect cancer earlier in our never smokers.
Yeah, I mean, this gets to Dr. Dagogo-Jack's presentation, whereas, as you mentioned, our conventional assays, for liquid biopsies that are currently approved for clinical use now, that the sensitivity really is dramatically improved by disease burden. So if you have widely metastatic disease, you're much more likely to detect mutations. Similarly, if it's limited to the chest, like your sensitivity may be lower. But I think where the field is really moving is to really drive down the sensitivity of these assays to, be able to detect, very, very rare, circulating tumor DNA molecules, to where, could someone with, undetectable, disease by conventional imaging, have, circulating tumor DNA detected, and would that, impact prognosis or help strategize, various, clinical trials for adjuvant therapies, et cetera. And then, moving even further into, could that impact, screening, using circulating tumor DNA and methylation assays, to develop, a high risk, phenotype of patients who might, demonstrate improvement from low dose CT screening. And so I think the field is really, really, pushing in that direction. Like each year, these assays become increasingly more sensitive, and I think the goal is really to make them, as sensitive as possible, to really to be able to detect, patients post-surgery who might have minimal residual disease that is not detectable by conventional imaging, and, to really impact, screening that was mentioned, to both improve, risk stratification of patients, even who may be never smokers, and to maybe improve the uptake of CT screening.